Local anesthesia, mental incisive block. The equipment needed for this procedure is as follows: personal protective equipment, syringe, 27-gauge short needle, gauze, anesthetic cartridge, topical antiseptic, optional, topical anesthetic, cotton tip applicator, and hemostat or cotton pliers. The mental block is used to anesthetize the gingival tissue of the mandibular anterior teeth and premolars on one side. The incisive block anesthetizes the pulp and periodontium of the mandibular teeth anterior to the mental foramen, usually the mandibular premolars and anterior teeth, as well as the facial gingival tissue. Both injection techniques are nearly identical, with one exception. If you want to ensure that the incisive nerve becomes numb, apply pressure to the mental foramen for 2 minutes after administering the local anesthetic. If you need to anesthetize the lingual gingival tissue, an IA block would be administered instead because the incisive block does not provide any lingual tissue anesthesia. You may also consider an additional supraperiosteal injection of the lingual tissue. The deposit location or target area for the mental block and incisive block is anterior to where the mental nerve enters the mental foramen to merge with the incisive nerve and form the inferior alveolar nerve. The mental foramen is usually located on the surface of the mandible between the apices of the mandibular first and second premolars. The mental foramen in adults faces posterosuperiorly. You can locate the mental foramen on a radiograph before performing the block to better determine its position during palpation. To locate the mental foramen for the mental block, palpate with a cotton tip applicator intraorally the depth of the mucobuccal fold between the apices of the mandibular premolars or at a site indicated on a radiograph until you feel a depression on the surface of the mandible surrounded by smoother bone. Load the local anesthetic syringe as demonstrated in the procedure, loading the metallic or plastic cartridge type syringe. Before injection, follow all steps as demonstrated in the procedure, basic injection technique. Currently, there are 2 pathways or methods by which these nerves can be anesthetized: directing the syringe barrel horizontally or vertically. Although both techniques provide the necessary anesthesia, the horizontal pathway is preferred because it keeps the syringe out of the patient's line of sight and offers a direct view of the large window during aspiration. Determine the syringe approach and assume the correct operator positioning at 8 o'clock right side or 9 o'clock left side for a right-handed clinician, or 4 o'clock right side or 3 o'clock left side for a left-handed clinician using the horizontal approach, or 12 or 1 o'clock using the vertical approach. Ask the supine patient to open the mouth and retract the lower lip outward, pulling the tissue taut. You may use a piece of sterile gauze to help retract slippery tissue. Locate the mental foramen, which is usually between the apices of the mandibular premolars. Dry the penetration site and prepare the alveolar mucosal tissue with topical anesthetic anterior to the mental foramen in the depth of the mucobuccal fold. Topical anesthetics are most effective for patient comfort when applied for 1 to 2 minutes. Dry the tissue to remove any excess topical anesthetic. For the horizontal approach, establish a fulcrum and then direct the syringe from the anterior of the mouth to the posterior in a horizontal manner, with the syringe barrel resting on the patient's lower lip and on the index finger of the retraction hand. Insert the needle to the depth of the mucobuccal fold, directing the needle anterior to the mental foramen, approximately 1/4 the depth of the short needle, or 5 to 6 millimeters. Aspirate by pulling the thumb ring back gently on 1 to 2 millimeters at the injection site to prevent the possibility of an intravascular injection. If aspiration is negative, slowly deposit 0.6 to 0.9 milliliters, or 1/3 to 1/2 of the cartridge over 30 to 60 seconds. If the tissue balloons, the injection is too rapid, and you should stop the deposition and remove the needle. Carefully withdraw the syringe and immediately recap the needle using the one-handed scoop method with a needle sheath prop or other recapping device. If the pulpal anesthesia is required, apply firm pressure to the injection site for a minimum of 2 minutes to help the solution into the mental foramen anesthetize the incisive nerve. Then rinse the patient's mouth. If only soft tissue anesthesia is necessary, do not apply pressure to the foramen, and only the mental nerve will be anesthetized. Complications with this injection include pain if the periosteum is contacted during the injection, hematoma, or inadequate anesthesia due to injection of an inadequate volume of anesthetic into the mental foramen. In addition, inadequate anesthesia could result from crossover innervation from the mental incisive nerve from the contralateral side, in which case a supraperiosteal injection over the mandibular central incisor of the contralateral side may be indicated.